Alarming signs of diabetes at night. First symptoms. Are you having symptoms such as nighttime leg cramps, restless leg syndrome? I do. And intense or disturbing dreams? If so, it's important to discuss these symptoms with a healthcare professional for an accurate diagnosis and treatment options. So, what are the most frequent symptoms of diabetes at night? Diabetes can present in numerous ways, particularly with symptoms that emerge at night, which could signal early stage diabetes, guys. Even if you're not on diabetes medication, including insulin, these symptoms might indicate a need to adjust your treatment plan. I'll discuss several signs of diabetes that are particularly noticeable at night, which, if identified, should prompt you to seek early detection and treatment for your health. I'll also share 3 potent natural remedies which you're likely to have in your kitchen to help maintain blood glucose levels or blood sugar levels and fight diabetes the natural way. I prefer the natural way. I mean, sometimes you can't help it, you have to be on medication, but if you can do it naturally, why not? Where you have less side effects and things like that. My name is Mr. A1C. I do have a medical background. This is not a medical channel. This channel shares my diabetic journey and how I was able to reverse my type 2 diabetes diagnosis using common sense with trial and error, so you don't have to make the same mistakes as I have, and hopefully you'll be able to reverse your diabetes diagnosis as well. So sleep apnea, guys. Sleep apnea is a serious condition where a person's breathing is interrupted for brief periods during sleep, causing a drop in blood oxygen levels. This can result in individuals taking sharp breaths upon resuming breathing, often without conscious awareness. While not immediately caused by diabetes, there's a recognized link between the two conditions, with up to 50% of diabetes patients potentially having sleep apnea. That's a big number. If you're experiencing excessive daytime sleepiness, fatigue, or daytime drowsiness, these could be signs of sleep apnea. That used to be me years ago. Given the association, it's important to check for both conditions if you suspect either. Here's another one. Urinating a lot at night. If you're a diabetic, you're familiar with this. Pay close attention to the symptoms. Frequent urination during the night is also known as or called nocturia. This can be one of the first signs of diabetes, as was the case with a friend of mine. After noticing he was urinating several times during the night, I inquired about his consumption of liquids. So what did he drink at night? And did it have a diuretic effect? So liquids with diuretic effects and what he ate at night. I asked him all these questions. So when these factors were ruled out, I suggested that he check his fasting blood glucose level, because that's huge for me to be able to understand where I'm going with my diabetes or my blood sugar control. I check my fasting blood glucose first thing in the morning on an empty stomach. And his fasting blood glucose was 250, indicating that he was probably diabetic. So after starting treatment with metformin and making lifestyle changes because he saw his medical provider, something such as improving his diet, incorporating anti-inflammatory foods, which we talk about quite often on this channel, exercising and lifting weights, which we also talk about. Most of my videos are done in my workout gear. That's why y'all see me with a hoodie on or sweater or something like that. So weightlifting and exercise is very important to us diabetics. But he was able to stop taking metformin, guys, within a year, and now maintains his blood sugar levels naturally, the way I do. So the stuff that I talk about on this channel actually works because he followed it and it worked for him. So if you're experiencing these symptoms, especially if it frequently disrupts your sleep, it could be a sign of diabetes or other underlying issue. It's always a good idea to consult your healthcare provider and have your blood sugar levels checked or blood glucose levels checked. Second, regular exercise, particularly muscle strength activities, so muscle training or resistance exercises, can have significant benefits for people of all ages, including those that are middle-aged, especially people that are diabetic. This can potentially reverse the effects of aging by a decade or more and even reduce the need for medications. I can attest to that because I bet you can't guess how old I am. And I look probably, 15 years, 20 years younger than I really am. And because I'm able to control my blood sugar has allowed me to not be on diabetic medication. So it's important to note that it's never too late to start exercising and reaping its benefits. I'm not telling you exercising is one of the things that we all want to do, because I'll be honest with you, I hate exercise. but I do it 3 times a week because I understand the benefits that I'm going to get as I age, especially with high blood sugar or trying to control my blood sugar. However, it's crucial to consult with a healthcare provider before starting any new exercise regimen if you're a diabetic. They can provide guidance based on your specific health needs and conditions. And don't forget to talk to your registered dietitian as well. So here's something else. Restless leg syndrome at night and numbness in the feet. Right? So I'm sure we've all experienced restless legs every now and then. Experiencing restless legs or nighttime tingling is a common occurrence, particularly among individuals with diabetes like ourselves. During the day, you might not even notice anything, but as night draws closer, you may find it difficult to settle into a comfortable position or feel a strong urge to constantly move or wiggle your legs. This can be due to several factors related to diabetes, such as changes in blood circulation, high blood glucose levels that can affect nerve function, so high blood sugar that can affect your nerves, or imbalances in the level of iron and other minerals in your blood, leading to discomfort in your limbs. So in some instances, the symptoms may present as numbness or tingling, often in the feet, which can be an early sign of diabetes as a result of more advanced diabetes with complications like neuropathy. We've spoken about neuropathy in the past. That's nerve damage, and that's where sometimes people have their toes and the bottom of their feet are numb and they feel a tingling or shooting pain sensation. That's later stages in diabetes. Then you don't want to get to that point. As such, it's crucial to get medical evaluation to check for this condition. So here's something else, guys. Nightmares and night terrors. When a person is diagnosed with diabetes, it can bring out a lot of changes and challenges in their lives. Now, we don't all experience this, but some people do. One of these challenges is managing sleep disturbances. High blood glucose levels can lead to a diuretic effect, causing the person to urinate more frequently, especially at night. This can result in dehydration and feeling of excessive thirst known as polydipsia. This increased thirst and frequent urination can disrupt the person's sleep pattern, leading to sleep disruption and fatigue during the day. Moreover, high blood glucose levels can affect the brain's chemistry, including the release of neurotransmitters as serotonin, which can lead to disturbing dreams and even nightmares. So I bet you guys were wondering why I was talking about polydipsia, but this is how it leads to some of the issues that we're talking about, the nightmares and night terrors. This, combined with stress and anxiety, can often accompany a diabetes diagnosis and can further exacerbate or make the problem worse. It is important to note that while not everyone with diabetes will experience these symptoms, any new onset symptoms related to sleep disturbances should be checked by a healthcare professional. That means you start experiencing this, please see your doctor. This includes testing blood sugar levels to determine if diabetes is the cause. Managing diabetes requires a lifelong commitment to changing one's lifestyle, including the way they look at food, or the way we look at food. I talk about this all the time, right? You know, this is not a temporary solution that we talk about on this channel. This is a lifestyle change. A balanced and nutritious diet can help manage blood glucose levels and improve your overall health. It's a common misconception that eating well is expensive, but with the right knowledge and approach, it is possible to take advantage of the nutrients and medicinal properties of common foods without breaking the bank. If you or someone you know is experiencing sleep disturbances related to diabetes, it's essential to seek medical advice or advise them to seek medical advice and support. With the right treatment and medical strategies, it's possible to improve the quality of life and effectively manage diabetes. So we just talked about this in brief. Being very thirsty at night. When glucose levels in the blood are unusually high, exceeding 200 usually, a diuretic effect is triggered, leading to increased urination at night. During the day, despite the frequent urination, you may not even experience thirst due to readily available water. Meaning, you drink water, you don't even think about it, you fill your cup with water or you fill your container with water, you're just drinking water, so you don't even notice it. But at night, you're not doing that, you're sleeping, so that's when you're going to notice it. However, the nocturnal production of urine can result in dehydration, causing you to wake up with a dry mouth and intense feeling of thirst. Even other issues as well. The heightened thirst, a condition known as polydipsia, which we talked about briefly earlier, is a common initial symptom noticed by individuals with diabetes. So do you see the link in some of the things that I'm talking about today? A lot of these things are linked together, so these are things you're going to have to pay attention as a diabetic. And this thirst often leads to individuals keeping a water bottle by their bedside, even if they don't wake up due to thirst. They may find, upon waking that their mouth is extremely dry, or they have developed canker sores, which is the other problem I just talked about, and painful mouth ulcers. So this dry mouth problem can cause other problems like canker sores and ulcers in the mouth. Moreover, this condition can also result in bad breath, guys, and dental problems such as cavities due to the high sugar content in the saliva. I bet you guys weren't aware of that. Therefore, it's crucial to manage blood glucose levels to prevent such symptoms and potential health complications. Something else you may experience is going to be blurred vision at night. The second symptom to watch out for is blurred vision, particularly at night or in dim light. I'm sure many of you are aware of this and can attest to this. This can be caused by sudden changes in blood sugar levels or blood glucose levels. Some individuals find their vision significantly impaired when performing tasks such as driving in the evening or at night, or when getting up to use a bathroom. So if you're experiencing this, it's important to consult both your healthcare provider and an eye doctor as well, as this could be an early sign of diabetes. If you're a diabetic, your vision is hugely impacted by your blood sugar levels. Should high blood glucose or blood sugar be the cause, implementing treatment and modifying habits and diet can improve the symptoms within a few days to weeks, guys. So here's something else you probably are aware of as well: leg cramps. Living with the symptoms of high blood sugar levels such as excessive thirst and nocturnal leg cramps can indeed be frustrating. These leg cramps can be attributed to several diabetes related issues. Dehydration caused by high blood glucose levels is one such cause. Additionally, circulation problems, which can reduce the supply of oxygen and nutrients to your leg muscles, also leads to these cramps. Fluctuations in blood glucose levels can also cause imbalances in essential minerals like potassium, sodium, calcium, magnesium, and potentially leading to cramps as well. Neuropathy, which we touched on earlier, the nerve damage, the tingling at the bottom of the feet, or the shooting pains, or nerve damage, is another possible cause indicating more advanced diabetes, as we discussed earlier. It's important to remember that you're not alone in this struggle, guys. Many people worldwide are dealing with similar issues. Fortunately, effective treatments are available for diabetes, and with early detection and management, it's even possible to reverse diabetes in some cases. I can tell you it's possible to reverse diabetes because I reversed my diabetes diagnosis, and I know you can do it as well. I have faith in you. Making long-term changes to your diet and lifestyle can significantly improve your quality of life. So again, we've always talked about this in all of my videos. Long-term changes to your diet and lifestyle. It's a lifestyle change. It's a different way of looking at food, a different way of looking at life. When it comes to dietary adjustments, the goal is not to diet temporarily like most people think, but to alter your long-term approach to food and nutrition. The food you consume provides not only calories, but also essential nutrients and active compounds that benefit your body, especially if you're a diabetic. A balanced, nutrient-rich diet doesn't have to be expensive. It becomes costly only when complicated unnecessarily. Keep it simple, stupid. The KISS method, K-I-S-S. Keep it simple, stupid. Just keep it simple, use common sense, and you'll get through it. By making the most of common foods, nutritional and medicinal properties, you can effectively manage your diabetes and improve your overall health. I'm here to tell you that that's true. Now I'm going to tell you guys about 3 foods that actually work. So, ACV, apple cider vinegar, which we have discussed in previous videos, guys. Apple cider vinegar has been found to potentially lower blood glucose levels and may be beneficial for diabetes management. And they say the word may, it actually is beneficial for us diabetics. It can be used in a few different ways. You can add a tablespoon of apple cider vinegar to a carbohydrate-rich meal such as beans, lentils, or rice. It's been shown to help reduce high blood sugar levels that spike after eating. You can also, number 2, dilute a tablespoon of apple cider vinegar in a glass of water, which is my method, either cold or warm water, and drink this before lunch or dinner. I drink it before all of my meals, or I should say with my meals, but I've got a whole separate video on that. It's called my diabetes, I believe the video is called my diabetes blood sugar lowering drink. Take a look at that video if you're interested in what I put in that drink. And I drink it before every meal and with my meal. So be sure to dilute it, as pure vinegar can be harmful to your mouth, teeth, and esophagus. The active ingredients in apple cider vinegar is acetic acid, which is also present in other types of vinegar. Even if you don't have organic apple cider vinegar, you can still use regular vinegar, guys, as it will have the same active ingredient. Remember, it's important to check with your healthcare provider before starting any new treatment or anything that we discuss on this channel, even if it's a natural remedy. They can provide advice based on specific health situations. So did you guys know pomegranate, which I've discussed in a previous video, is another one? Pomegranate is another natural remedy that has been found to be beneficial in some scientific studies. The recommended dose is typically a glass of 200 to 250 milliliters, which is 3/4 to 1 cup of pomegranate juice, consumed daily for about 3 to 4 weeks. So I personally, I want to discuss my journey with you and how I was able to overcome this. So I tend to give you my feedback on some of the things that research has put out there for us diabetics. And I personally, I don't just drink the juice. I have pomegranate, the frozen pomegranates that go into my post-workout smoothie or shake, whatever you'd like to call it, 3 times a week. So that's how I get my pomegranate. However, due to the limited availability of fresh pomegranate in some areas, consuming it 2 to 3 times a week still can provide significant benefits. And that's what I do. I get it 3 times a week. To prepare pomegranate juice, you just use the seeds of a whole fruit, blend them with a 200 to 250 milliliter of water, and drink the unfiltered juice. And yes, you can eat the seeds. Alternatively, you can consume the seeds directly from the fruit or even prepare an infusion with the peel. Make sure you wash all the residue off the peel if there's pesticides on the peel, using vinegar and things like that. And when I say an infusion, I'm talking about you can infuse it in, let's say, tea, for instance, or something like that, some type of drink. So I bet you didn't even know I was going to talk about this. Beets. There's so many benefits to beets, guys, and for us diabetics. Drinking beet juice or eating beets daily, especially with exercise, can have wonderful effects on your health. And I eat beets 3 times a week. My mom grows beets organically, and I always get the dehydrated, sliced up beets from her. I keep it in a Ziploc bag, and when I'm making my smoothies after I work out Monday, Wednesday, and Friday, some of those beets go into my smoothies as well. So beets can improve circulation, reduce inflammation, improve insulin resistance, control blood glucose levels or blood sugar levels, and manage high blood pressure. So beets are a wonder vegetable for metabolic syndrome that we diabetics have to deal with. You can prepare it by blending a whole wheat with the skin in water, and you can add ingredients like turmeric, ginger, and mint for flavor. I've talked about turmeric and ginger and things like that in previous videos. So if you want to know about that, take a look at those videos. If you prefer, you can also eat the raw beet in salads or lightly cooked. Remember to stay hydrated too, that's part of it. Give it a try for a few weeks and share your results back with me in the comments below. So I'm glad you guys are enjoying my content. If you feel that it's helpful and valuable and it's providing something to help you in your diabetes journey, please consider subscribing to the channel for more great tips to reverse your diabetes and to control your blood sugar. Don't forget to share this valuable information with your friends and loved ones dealing with insulin resistance, metabolism issues such as metabolic syndrome, and or diabetes. That's it, guys. You guys have a wonderful day, and I'll see you on the next video.